So 43 states, 43 are seeing a rise in cases. And this morning, we wanted to get a real-time look at what's happening on the ground in one state in particular that's dealing with a major surge. We're talking about Wisconsin. Hospitalizations there have doubled within the last month. And Dr. Jeff Pothof is on the front lines there. He's an ER physician. He's also chief quality officer at University Hospital in Madison, Wisconsin. Dr. Pothof, good morning to you. I know you're busy, so thanks so much for your time.
Good to be on the show with all of you.
Give us a snapshot, if you can, of the situation at your hospital. How many patients are coming in compared to what you saw just a few months ago? How worried are you as we head into this holiday season?
Yeah, compared to our previous peaks in March and April, our volumes are doubled. We continue to break record number of patients each day in our hospital, and we're having to expand our footprint for COVID-19 patients. Before, we might have been able to take care of all those patients on one wing of a unit. Now, all three wings of that unit are full, and we're looking for more space. So I'd love to tell you that we're doing great, but we're struggling.
My goodness, I was just about to ask you, obviously the pandemic has been around since March, but this is the first time Wisconsin specifically has dealt with these large numbers. So did the gift of time over the spring and summer help you at all as far as preparing for the rave?
Yeah, we watched very carefully what happened in New York and Washington State, and that got us to take action. We made very robust plans on how we could optimize every square inch of our infrastructure to care for COVID patients, and that's been invaluable now that we've had to dust off that plan and act on it. But really, the biggest constraint we have are critical care staff. We can convert rooms, we can get some supplies. It's hard to create new critical care nurses and critical care physicians.
Dr. Jeff, you've got experts saying the one thing we can do is wear a mask to help ameliorate these issues. And you've got a statewide mandate there in Wisconsin, but it seems compliance kind of haphazard. Why do you think wearing or not wearing a mask has kind of become like a political statement?
Yeah, I think that's a really interesting thing that people will talk about for a long time. But, here in Wisconsin, I think we've done a really good job of sending citizens a mixed message. One leader will say, you need to wear a mask. It's really important. Things are bad. Then another leader will say, you know what, that coronavirus, not such a big deal. We're not even sure masks are effective. And people are trying to make educated decisions to keep themselves and their families safe. But unfortunately, with all that misinformation out there, they're making a wrong assessment of the risk that they're taking on by not wearing a mask and not distancing.
And what do you think is going on here? Because, at the beginning of this, it was talked about so often that everything needs to shut down. Restaurants are closed, stores are closed. But do you think with the rise in cases now that areas like Madison or Milwaukee or just the whole state in general should begin tightening restrictions? Could lockdowns be possible once again?
If we look at what happened earlier when we started to have the safer at home order, we started to have mask mandates, at least at the county level, it absolutely was effective. Our curve flattened. And if you look what we did after that, which is kind of let everyone decide what they want to do for themselves, that's not working for us. We have people getting sick. We have people dying. So I don't know if we need to have, machete-like lockdowns all over, but certainly something that is mandated that really gives a clear message to the citizens of the state what they need to do to keep themselves safe, to get things back to normal. That would be welcome.
I know people are feeling COVID fatigue, but we have to hang in there. Dr. Jeff Pothof, thank you for your time and what you're doing out there.
Thank you.